today we are going to be working on cleaning up for next week. We have a couple of events going on. We have a buyout on Tuesday, and we also have the FCOL, Full Circle of Life workshop that'll be going on from Monday all the way until Thursday. We'll be cleaning the new vet building up top, intake building. We're also cleaning all of the barns and the vet hospital and the intake, and just getting everything ready and freshened up for all of the groups that will be coming in next week.
To come up. So we are working on our kind of training arena thing out here that we're going to use for our gentlers, just so they have a little bit more riding space with the horses. So we're just working on getting the pins out right now, and we're going to surround this whole area with some of our higher heavy duty panels for the horses. So
the heaviest panels.
The heaviest panels on the property. So we will definitely
get our workout for the day.
Yes.
Up, up, a little more. There we go.
There you go. Hit it, Cody. So we are almost done with the outdoor arena, but we are currently out of pins. So Chandler's gonna go take a break and scrape some more scrape some more pastures, and we are gonna go.
Boss lady is calling for us to do something else, and then we'll be back to this.
Yes, we will go finish one task, and then we'll do this task later on once we get more pins. So stay tuned.
Good morning. Sydney and I are on our way to Tennessee Equine with Admiral George. He's gonna go get his teeth checked out, possibly get a couple removed. We started our morning bright and early again, just like we did when we brought Gray up. Had to fill a flat tire first, making sure we could get there. But Admiral loaded pretty well. He was a little hesitant to get in there, but he is in, and we are on our way. It is very bright this morning. Good luck. So we made it up here to Tennessee Equine. So we are just waiting for them to finish their rounds, and then they'll come grab us to take a look at Admiral. So we're just gonna let him hang out and nibble on some grass while we're waiting.
George got his teeth done. He's super sleepy. We're having to baby step it back to the trailer. He had some sharp points, so maybe he'll feel better now.
All right, we are on our way back with Admiral George. Everything went really well. Dr. Alvaro did some x-rays, used his scope again, just like he did on Gray. He pretty much, the biggest concern was just the wave in his teeth. So the two teeth that we were really concerned about on the top, his number 9s, they did have changes on radiograph, but ultimately they weren't mobile. He wasn't super concerned about them as far as having to pull them. He didn't recommend extracting those today. So he floated his teeth, got all the really sharp points down. Those number 9s are pretty much almost gone, which is why those bottom teeth have grown up so much. So he had a lot of really sharp points, causing sores on his cheek and his tongue. We've noticed he lost a little bit of weight in the last couple weeks, so we're wondering if maybe that's why, because those sores would have made it painful to be chewing. So hopefully that'll help. Everything is nice and smooth now. He recommended 6-month dentals for him, just to stay on top of everything, get some of the length down on those bottom teeth a little bit more. Admiral did not want to get back in the trailer. He was being very stubborn. A very nice woman came and helped us, so we had an extra person.
Like 4 of us. He was being stubborn though. She was like, I can tell he's not scared. He's being sassy. And I'm like, yes, very sassy.
Yep. So she got some grain, And then he was a little more enticed. He didn't want our snacks, he wanted grain. So we got him loaded finally after a good probably 15 minutes, 20 minutes. And are headed back, made it through a nice traffic jam, and hopefully it is sail smoothly the rest of the way.
I was asked ever so kindly by Chris and Tawny to get all of the presentations for the Full Circle Life workshop that we're having next week, to get all those printed out. I'm halfway through with day 3. This is all day 1 and 2. This lovely stack right here is 12 copies of Dr. Lydia's presentation for the 3rd day. So once I get everything printed out, I'm going to be putting them all into individual binders. We're going to put the Full Circle of Life logo in the very front, along with the schedule for the PowerPoints as they go through them. Each PowerPoint has got a little notes section on the side, so that if anyone has any notes to take down or any questions that they want to write down and ask at the end, they've got plenty of space for it. So that's what I've been working on majority of the day today and part of the day yesterday, and I'll probably still be working on it tomorrow. But yeah, I am killing trees in printer ink.
I got my head on straight so you can pass the loose.
You're not furry on this side. Right now I'm just touching her with this. We haven't really handled her too much. I'm just desensitizing her a little bit, just petting her. And she's really shedding, so I'm trying to take off a lot of these. He's kind of working on making her face up, and he's working on touching her. She's really touchy and very scared and skittish. He's able to catch her, but it'll take some time. But after a while, he's able to pet her and everything.
Who has been your favorite to work with so far?
I can't remember her name. It's one of the little Mustangs. She's the smallest one out of the 3. They were all pretty wild at first, but after, I think, the first couple days of us being here, she really calmed down. She took her test to see if she's leadable, if you can pick up all 4 of her hooves, and if you can catch her, all of that, and she passed. I think it was a couple days ago. So she's coming out really good. Oh, and then the mules, the Monty and I forgot the other one's name.
Skeeter.
Yeah. Monty had fun dragging Shane around. At first, her mind was kind of everywhere. When she would get in here, she was really scared. She would run. If she could, she probably would run all day. And she was just, I guess, pretty terrified, and she would almost run through panels, things like that. And they warned us. They're saying she will. And so we'll bring her in here, and depending on how she is, we'll stand out here until she calms down. Then we'll go in when she calms down, because we don't want to add more pressure to her until she calms down. She's taking more time, but she's a lot better than what she was when we first got here. When we first got here, she was just really, really scared and going crazy in there. But now you can get close to her. Now you can pet her. It'll just take some time, and you can catch her, but takes a while. We can hold to her now and all of that, but it just takes time to do it.
Are you excited to be back?
No, sir. Back home. back home with his good teeth.
So this morning, Cydney and I took Admiral George up to Tennessee Equine. We had seen that he had some changes in 2 of his upper molars and then had quite a wave in his mouth. So we wanted to send him up there, just have Dr. Alvaro take a look at him, see if those teeth needed to be extracted. He didn't think that the 2 upper molars needed to come out. They weren't mobile. It just looked like they were basically almost completely gone. There was very little root left. And because those had worn down so much, the bottom molars had grown up really tall. So he had a lot of sharp points on every arcade of his mouth, and they were causing little lesions on the sides of his tongue and cheek. So they figured those were probably pretty painful. No extractions, they just floated his teeth, got those sharp points off, and then ground down a little bit of that length on those lower molars that were really tall. And then he just recommended 6-month dentals instead of annual, just to stay on top of it, because he didn't want to take too much off that length all at once. So we would probably have to take those down a little bit more in 6 months. But otherwise it was very positive. So we're very pleased with his visit up there today.
I know, he's so impatient. One thing about Admiral George is he is always ready to go. Hold on, there we go, now go.
So almost 2.5 hours later, we have completed our outdoor arena to the best we could. There's still a few more holes we got to patch up, but right now our gentlers have approved it, so we are excited to hopefully see them using it within the next week before they head back and our new batch come in. I'm very happy to see that we finally have a place to actually exercise the horses a lot better. There's a lot more room to do the training work with them, so hopefully you guys will be able to see how all this hard work. Only had 1 injury today, so we are making progress.
Good boy. There's a good boy. Yeah. Everybody ready? Yep. No evidence of kissing spine, no obvious signs of arthritis. It's gonna be a little obliqued, so we're gonna have to keep that in mind when we evaluate joint spaces that I shot up a little bit. Torb is good stuff, isn't it, sir? This handsome boy is named Chris Mars Indy. He is a thoroughbred. He was surrendered with a group of horses to Horse Plus. I've been gone for 2 weeks, so it's kind of fun for me. I came back and we had all these new horses. He's just gorgeous. His owner passed, so he underwent a period of neglect after that, and thankfully he ended up here all the way from California. So he was a little bit fearful of entering the chute. I think he had some trauma with that long of a trailer, but otherwise he's been a pretty good boy for us. You can see his hooves are in really bad shape. These guys are on the ASAP farrier list, but we took some x-rays of the major joints in his body, didn't see anything significant, took some x-rays of his back and his mouth. He has 2 upper teeth that were getting excessively worn that are at high risk for, or could possibly already have some cavities, some caries. He needs the mandibular nines reduced just a little bit. So I'm gonna give him a little bit more Dorm. Don't feel any mobility or softness with my fingernails in those nines. I was able to reduce the primary problem, which is that those lower teeth were wearing those teeth too much, but we'll probably need to keep an eye on those teeth as his mouth evens out after his dental to make sure those teeth don't need to be extracted. But otherwise, other than having some excessive fatty deposits, he seems to be in good shape. We haven't done any lameness evaluation with him. We were told that these horses had never been ridden, and some of them are a little jumpy, but they seem to be really smart, and once you get a halter on them, pretty cooperative. So our amazing trainers are working with them, and we're finished medically with what he needed today. We've got a bunch of other horses to look at, so we're gonna have Kody put him back in his stall as long as he can walk out there, and we'll get the next horse in. So Indy and now Charlie. Hi, Charlie. You're such a good boy. You're very handsome. We're just gonna look at you today, okay?
It's the spine of your scapula. You don't have much space between your dorsal spinous process and the outside world. Okay. These back muscles are pretty thick.
Oh, yeah, those two
look like they're almost touching. Maybe I'll try coming from the medial side.
Okay.
So all those joint spaces look collapsed, but it could be the angle. So I just want to. Oh, come on, Dot. Not on the other side looks a little wonky. Some space around them from the gums. He's got some dorsal spinous processes that are getting really close to, like they're like this close to touching. Okay. And his hocks are collapsed. All right, so this is a dorsal ventral view of his face, and these are his upper arcades that you can see on the outside, and then his mandibular teeth are on the inside. So these two teeth are 9 and 8 on this arcade, and they're increased lucency compared to other teeth around it. So those probably have dental caries or cavities, and they're at increased risk of fracturing or falling out. The 9 on this side and the 8 on this side are starting to go compared to the other teeth around it, but they're not as bad. He also has increased space in the gum line, and he's got increased spaces between his teeth. Not terrible, but they're there. And that's just his incisors over top of each other, so he might have some pulp exposure. It means the sensitivity into the pulp cavity, so it means the inside of his tooth canal is exposed.
Yeah, you need a little work done, my friend. Let's get you doing better. I don't want to take off more, but number 9, you can let go of the tongue. Thank you so much. Number 9, it's really just one tooth. I just don't want to take off too much, and I just took off a lot. So yeah, I would do Q 6-month dental. Power hand floats ain't gonna cut it.
This pulp cavity on this lateral incisor is pretty big, like this dot on the when he opens his mouth. He's trying real hard not to.
Can you pick a lane? He's like, don't touch it.
This is Chris Mar Charlie. He's approximately 15 years old, thoroughbred gelding. He was in today just to do a really brief physical with some radiographs and a dental. We did withers, back, hocks, carpi, and his dental radiographs. He's got some minor calcification forming in his nuchal ligament over his withers, and some of his thoracic and lumbar spine, his dorsal spinous processes are really close to kissing, but not touching, but they are centimeters away. His carpi look good. His right front carpi is over at the knee, and that's a conformational thing that he's probably had since birth. A lot of that's contracted tendons and things like that we're not going to get into when talking about him. And then his dorsal metacarpus, or his cannon bone, is thickened on that side, and you can see it grossly on the outside. We took a radiograph and confirmed that, yeah, that part of the bone is actually thickened, so he might have had an injury at that location a long time ago, and that's how the body repaired itself. His hocks, the joints are all collapsed, which is not a game changer for him, but it does increase arthritic pain and things like that. Once they're totally ankylosed down, it kind of relieves some of the pain, but there's still going to be some local inflammation and things like that. Maxillary 8 and 9 on one side have increased lucency, and his 9 on the other side has minor increased lucency, not as much as the other side. They're not mobile. He's got some minor joint or teeth spaces are starting to increase, but they're not horrible. And his mandibular rostral cheek teeth are starting to get furcations where the gums are starting to recede and the part between the tooth roots is starting to be exposed, but they're not completely exposed yet. But based on all of those findings, when Dr. Lydia did his dental float today, she thinks he needs to be looked at every 6 months. So we'll have him in again in 6 months if he's still here, or whoever adopts him will need to have somebody that has the kind of power float or equine dentist that has more advanced tools than just the hand floats. But otherwise, he seems to be in pretty good health.
He has a laceration in the lateral canthus of his eye right here. He sustained this during trailering here. And you can see it's really nice and healthy. There are no indications of infection. It's already granulated in. If I wanted to suture this today, which I do because I love suturing, I would have to take some scissors or a scalpel blade and remove some of that tissue to make it bleed again, freshen those wound edges up, and suture it together. And Nicole is exactly right. This is well on its way to healing just on its own. So we're gonna less is more it. So this is called autologous serum. It's the non-cellular component of horse blood, and it came from him. So this is really safe to put in the eye, and it has a lot of awesome anti-inflammatory and healing properties. I wanted to get this area really nicely lubricated and moisturized, but I didn't want to put in anything that was going to irritate the eyeball itself. So we're going to use this serum from his own body. Doing great. I am going to put a little bit of some other ointment on top of this, but I wanted to get it kind of inside, and I didn't want to irritate the rest of the eye. It's also just a great choice. A lot of clinicians use serum when there's a corneal ulcer. For one thing, it's basically free. You know, you just pull a blood sample and spin it down. But it's just very gentle, and it gives you a lot of the things that you would want for healing from the body without a lot of other stuff. Let's retake a lateral lower down, because I think we kind of missed that. And by we, I mean me.
No. Let's see if he'll be still. He may. Good boy.
Is that a special tooth? Looks like it. Maybe. Could be an oblique. But let's do incisor.
Yeah, he's got some space starting between some of his cheek teeth.
My favorite thing is the schmoopy lip in these lateral x-rays. Oh, dang it.
This proximal are blunted. That one looks compromised. Doesn't look quite normal. That's like real bloop.
Yeah. I can't tell if we have a fracture on one side that's making the other side tooth look weird. I think we just
Sometimes
need to...
we take them on both sides.
Yeah. Let's take the DP. It's got some spacing issues.
Oh yeah, those are some big spaces.
Yeah. Can we go a little bit more rostral? And then I think we've got all our priority images.
He also has a lot of atrophy on this side compared to this other side.
The atrophy's on the right or the left?
This side. Like this is more sunken on the right than the left.
Yeah.
Slightly, but it's...
I wonder if he had an old socket fracture.
What do you think about this little soft tissue something or other?
But it doesn't feel old to me. Like the old ones almost feel kind of crunchy. This one feels like real soft, but not warm.
Yeah.
I guess we should just
looks like a little bit of maybe some edema.
Yeah. I feel like I'm looking at the same two mouths I just looked at.
Yeah.
Okay. I need to rinse, and he does need some work. Okay, buddy. You're probably not going to love this. This sweet boy's name is Mr. Indy Pacific. He is a thoroughbred. He's about 16 years old. We did find some mild to moderate abnormalities in his mouth. So actually, all three of the horses that we just looked at had very similar problems. His numbers 8 and 9 teeth on the top of his mouth were overworn, and the 8 and 9 teeth on the bottoms were overgrown. So I was able to reduce both of those. But the last two horses, it was significant enough that I want to recheck them in 6 months or have another vet recheck them to make sure that those teeth are growing out well and that there aren't cavities or other problems with those teeth. He does have what looks like an old fracture in one of his vertebrae in his neck. I'm thankful that it's not in the region of his back where a saddle would be. Not that being a pasture pet is the end of the world. but we are definitely concerned about it. The nuchal ligament, the big soft tissue structure, runs right over there, and we don't ever want a horse to be uncomfortable. We don't know the horse well enough. We haven't observed him in pasture or in a training situation at all, and all of these guys are going to need full lameness exams. This is the radiograph that I mentioned, and you can see these vertebrae are a nice normal distance apart, and these two are pretty much touching. And then this one, we've got some major opacity changes and some bone chips versus ossification within that soft tissue structure. So we want to make sure that this isn't causing him discomfort, especially because these two bones are touching. And you hear us talking about kissing spine a lot. Kind of classically, kissing spine is in the areas of the back that undergo a lot of flexion and expansion, because these vertebrae are right above the scapula. They don't do that quite as much, but they do. I mean, the horse's whole back moves. So we need to make sure that an old injury that might not be overtly painful isn't causing low-grade chronic discomfort. So we'll be evaluating that more thoroughly later on. He's got a little bit of swelling in the right hind leg that appears to be soft tissue. And then he has this little funny mass versus swelling kind of in his right armpit that could be something as simple as a tick bit him and he had a localized reaction, but we're gonna keep an eye on that. Could be a tumor, we don't know. But overall, he seems to be in relatively good health, and we are finished with him for today. We're gonna put him back out. He also has pretty bad hoof neglect, so these guys are all on our stat farrier list, and we're gonna keep rolling with the next horse.
We are up in quarantine. We are cleaning and getting ready for our buyout. Kind of just scrubbing out our squeeze chute that we use for some of the more unhandled horses. Our working inmate here is vacuuming up the hair. So we're gonna get this all cleaned out, and then we are going to blow out the entire barn, chop back it, just make sure everything's clean and ready. Probably clean our restroom. Kind of do like a deep clean on the panels, rescue everything, kind of sanitize it all. So we're ready for our buyout next Tuesday.
Oh, look at that.
Voila.
It's perfect, Hailey.
I try. Ha! We are going to head back down to the vet barn. They have a warm water hose, so we're going to get some warm water, mix it with bleach, so that way we're able to wipe things down a little easier.
Okay, got the water. So why are there wood chips in there?
So Tawny, if I'm right, when I first came here, she asked me to go get wooden slabs when she was hauling horses, and she put them in the water troughs. And apparently, if I'm right, she said that the wood will kind of calm the water from sloshing all over the place. So we tried it out, and apparently it worked. Did it work?
It worked. I have minimal water
spillage.
On my boots.
So yeah, wood apparently will block wetness. Oh my wood! Don't drop it.
Okay, here we go. Come on.
So me and Amber are all done cleaning quarantine, so it is ready for our big buyout next week, and we are very excited to hopefully get these new horses in. And so we are now back down in Gen Pop, and we are going to go through the rest of the day today, just kind of getting stuff ready for the weekend, preparing for next week. So hopefully everything goes smooth for the rest of the day and nothing big happens.
Schmagigs, look at that foot. Ooh. Whoa, that is not what I was expecting. Holy moly.
Her upper teeth look terrible.
Yep.
At least in that view.
Yep.
Yeah, you got some bad teeth.
These guys all have the exact same problems. Okay, let's do a lateral incisor with the floppy lip. This is the youngest horse we've looked at, and she has the worst teeth.
Yeah.
Holy cow, look at those hooks and waves.
Ouch, ma'am. Got a pretty good ulcer right there.
Ouch. Honey, that looks ouchy. I bet you bit that cheek.
Probably.
I think I'm done. I'm gonna rinse and feel though before I take the speculum off. Please don't bite. That's much better. Okay, this cute little mare is named Indy's Glow. She is another thoroughbred. She's only 12 years old. And physical exam-wise, she looks great except for awful hoof overgrowth. So she's on our priority farrier list. And we were really surprised to find that she had absolutely the worst teeth of any of the horses that we've looked at today. We tend to think about hoof imbalance and overgrowth as a problem of older horses, but she had a really severe hook wave mouth on both sides and some other really sharp points. She has a big ulcer over here on the side of her mouth. That's probably from kind of biting her cheek. So we were able to get those really nicely resolved today. I'm gonna put her down for an annual dental, but she is one of those horses that's gonna need a dental every single year for the rest of her life. But I'm really happy with how it went. I'm optimistic about her future. And she's been a really good girl. Obviously she's sedated right now for having her teeth done, but we're gonna put her back in a stall to recover and get those hooves taken care of next.
Yeah, like his jugular fill takes quite a minute.
That vertebrae in the neck is so much lower in the neck than you think it is. What if we go ahead and go down this leg a little bit more?
Okay. You wanna do, are you doing all
let's just do laterals and then. I know we can't really get a foot rad, but let me try to get all the way to the ground. He's got some pretty significant changes on the lateral aspect of the right hock. But these joints look okay. So I guess I would just, like if this were a lameness exam, I'd be like, let's see how he moves. But his front end is a disaster. So he's off left front, right hind.
And so we're trying to get a good view of his feet, and we're trying to use lower materials to the ground so his foot he doesn't have to try and pick it up and bear more weight. But on this view, you can really see that pronounced chip, and there's lots of arthritis around multiple bones in his hoof capsule.
It looks like this.
Is it
chip? Is that
yeah,
the chip?
Yeah, that chip, but look at all these. Whoop, whoop.
Yeah.
I think we need the block.
Okay.
I mean, I think
do you guys want to try a DP and then we can swap to the block? Ew.
That doesn't look great.
Is there a gas opacity?
Looks like it, doesn't it?
Do you have a puncture wound or old scar or something?
Oozing and like active infection right at the, just proximal to the heel bulbs. There is like disgusting smelling frog infection. Beautiful. Do we have any thrush buster in that cabinet?
Yeah.
Oh my gosh, look at this. This is the length of the overgrown hoof. Perfect. Yeah, this doesn't wash out, by the way. I got that in my car seat when I was in high school. That looks pretty bad.
Yeah.
Is that another bone chip?
Could very well be.
It's not mud. I have another one right there. You can still look. Yep. P2 still got some roughening.
Yeah, that looks pretty gnarly.
Yeah, that's a lot. I think this horse is, of any of these horses, he seems really painful to me at baseline. Heart rate was only 44, I think it's probably chronic. There is a chance if we like aggressively, therapeutically shod him and did all that stuff that maybe we could get him sound. But maintaining soundness, even pasture soundness, is going to take like
a team.
A full team, plus we have at least 3 bone chips and we haven't even sat down and looked at the radiograph. So I would say for him, we should consider last act of kindness. He has seemed uncomfortable to us. He has muscle fasciculations just at rest. So just standing in his stall, he kind of stands and trembles a little bit. Dr. Gina noted that he's very tense over his top line. He's been sedated today for all of his stuff. So he seems very relaxed right now, but his baseline is just, he just looks really uncomfortable. He's got some unfortunate conformation in his front legs so that his knees kind of knuckle over in the front. His his front legs are very, very straight, and then both his front hooves are clubbed. There are options for corrective shoeing for horses with this conformational defect. Unfortunately, the worst thing you can do for horses with very poor conformation is neglect to care for their feet. In this case, there was nothing the owner could have done differently. The owner passed. And the people in charge of these horses got them here for appropriate care as quickly as they could. So there's no fault in the past, but you can see how bad the hoof overgrowth is. These horses are on our ASAP farrier list as soon as our farrier can get here. But when we took radiographs, what we found is that this guy actually has chips of bone in the area of his P2, which is the bone right above the coffin bone, in both of his front feet. So we knew that his soles were painful. He's got a bad case of thrush. That's very treatable. But we found actual bone chips that are in a joint space. So what that means is anytime he's going to flex those joints, we're going to have bone grinding on bone and some pain from that. He also has evidence of an old fracture in his right hock. It's funny, the rest of these horses have had really great joints. So I'm not sure if this horse was used differently or had an accident at some point, but his right hock is a bit puffy and swollen, and he has evidence of an old fracture there. So he's got pain in 3 out of his 4 legs. And we discussed his case pretty extensively today. What's really hard with horses, even lameness in one leg, is always how are we gonna support the support limb, because when we have pain on one side and they overload on the other side, but in this poor horse's case, he only has one good leg to stand on. We are going to give him some pain medication. He's actually already had some great pain medication today. We're gonna turn him out in a smaller area so that he might be able to lay down and rest. Unlike a lot of the horses that we get, we know the history of these horses, and they were predominantly stall kept in a very different environment. So we don't really know what they're used to. They seem really comfortable in stalls, but our stalls aren't really designed for long-term housing. They're kind of like recover from surgery and go back outside. So we're gonna put him in a different situation so that maybe he'll feel more comfortable wanting to lay down and get some rest. And we're gonna kind of discuss the findings with our team and see what we can do for this guy to try to get him comfortable. We don't ever want animals to be painful. I think it's a very human emotion to want to save animals, and in our minds that means keeping them alive. But Dr. Gina and I took oaths to do no harm, and so our job is to advocate for these animals who can't speak. In my opinion, they wouldn't choose a life of chronic pain. And one of the tough things about Horse Plus is that we want to believe the best in people, but we don't know the people who adopt from us. For the most part, we have a really extensive screening process. And if we have an animal that we can get comfortable with a lot of medications, but they're painful off of those medications, we don't feel like it's fair to them to go to, if one of our employees adopts them, maybe, but to go to a home where something might happen and that animal might not get their medications and might go right back to an unacceptable quality of life. So I don't think we're quite there with this guy yet. We have to sit down and look at his rads, but I am really concerned about him much more than the first 4 horses that we looked at from this group.
Put honey in it.
Someone just said a tornado touchdown nearby is headed towards Kennedys.
Eek! Let's put her
In this stall right here.
in that stall right there.
Yeah.
She'll be fine in the stall. Oh, you guys.
Yes, ma'am. All right, good.
Has everybody on property gotten the message?
Yeah, all of our phones are off.
Okay.
Hey, guys.
So we're out here because there has been a tornado warning issued and apparently it's really close by, so I think everyone's going to get to their safe spots. But first we're like taking a look, seeing how it is.
Look, Tony's watching.
We had brief moments of pandemonium. People were running around. What do we do? What do we do? Well, there was nothing to do because there was no tornado here. Because in California, we actually had the shelter taken out by a tornado. So we're just so thankful and grateful that no tornadoes hit here. But it was, you know, a lot of pandemonium. I got the drone out. What am I doing here? Oh, why am I looking straight down? Anyway, I got the drone out, got some cool weather shots. That's what's going on. And then everyone's like, well, what do we do if there's a tornado? There is a storm shelter here at the property. And we do have fairly solidly built buildings, so shelter in place. But yeah, we're all good for today.
Sorry, the image still hasn't come through. Here we go.
Yeah, kissing thing? That face is yes.
Let's keep going, but yeah, it's a lot.
I think you're probably gonna find some arthritis in her hops by the way it sounds when she walks.
Yeah, she's got no space.
Ouchies, mama.
These are the vertebrae that I'm really concerned about. Yeah, so we got here, here, here. I think I might want to change settings and see if I can get that a little bit crisper. Like,
oh yeah.
So we've got here and here.
Yeah.
1, 2, 3. I think there's another. Yeah. So those were those three, and then these vertebrae also look pretty darn close to each other.
I would agree that I think they're touching.
Okay. Yeah. And I think we have at least 1, 2, 3.
Possibly four.
4, maybe 5, 6. So I would say 4 to 6 vertebrae affected, and they're like
Right where the saddle sits.
right, yeah, they're to kind of like the rest.
Live in their heads. We were just talking about how radiographs are not always easy, you know?
Yeah.
Ooh, that tooth is terrible. Yeah. Is it fractured? We'll have to take a DP.
It's the number 9 again.
Yeah, all you guys related to each other got bad teeth.
What we found on her radiographs is very concerning. So you've probably heard us talking about kissing spine, and this one radiograph kind of shows a good example of it. So these are the vertebrae across her thoracic spine, and you can see these ones look totally normal with a nice black space in between. This is not the best. If any radiologists watch this, I know it's not the best radiograph, but it's just a screening one. So you can see these nice spaces, and then you can see here that disc space starts to get really narrow, and then right here and right here, these vertebrae actually come down and touch each other. And she's got 4 to 6 different areas that we identified. The reason for the 4 to 6 is when you get closer to the back part of a horse where their width gets wider, it's the quality of your image declines. And so I'm thinking that there are 6, but I could only really see the very top part of those vertebrae, and I couldn't actually confirm lower down that there was touching. But Nicole and Dr. Gina and I all looked at the radiographs, and we all agreed that we could confirm in at least 4 areas. Kissing spine can sometimes be non-painful for horses. A lot of thoroughbreds have it kind of congenitally, but anywhere you have bone touching another bone, and especially in a part of the body that should be able to flex and expand without touching, like the spine, it can be a concern. We also found that she has 2 teeth that were fractured and need to be extracted. So you can see in this image right here, they're her number 9 tooth in the top of both of her mouths. So you can see this tooth is normal, this is normal. This is that compromised tooth right there, and you can see this lucency change. And then you can see this one is not quite as bad over here, but you can see a space, a furcation between these 2 teeth, and then a lucency change in that tooth as well. And then we also found that she had some significant arthritis in both her left and right hock. Somewhat consistent with a 17-year-old, although based on her history of never having had a job or having a lot of exercise in her past or having injuries, it's a lot more arthritis than we would expect. So we are very concerned about that. We weren't able to fully assess the level of pain in her kissing spine because we identified it when she was sedated. These horses came in with very minimal handling, and so this mare was, being enough pushy on the ground that we couldn't do a physical exam safely without sedating her. So we're gonna have to do a better evaluation of whether or not they're comfortable. We always want to treat the patient, not the diagnostic. So we've looked at these x-rays. We know we have at least one tooth that's a major surgical extraction that needs to happen. And I don't do premolar molar extractions as a general practitioner. We have a wonderful partnership with the local equine hospital, so we refer our complicated dental cases there. We had a patient last month and another patient going there tomorrow. So they're awesome and they work well with us. But as a GP surgeon, I don't tackle those. There's a lot of things that can go wrong. And then I don't think we've run the blood work yet, but we had some concerns about possible metabolic disease with her. She has a lot of fatty deposits. So we are able to do that test in-house, but we don't have those results back yet.
But yeah, she's a feisty one.
Her head is probably really heavy.
No.
I mean, I can take over.
I mean, that's also as old as the other one's wound.
Yeah, I'm definitely gonna have to cut some dead stuff off.
Yeah. The tissue will die on the edges and stuff, and so if you close it now, it's just gonna deface with dead tissue.
I don't even think I can really close it all the way. Either here or there, close part of it and then leave the rest to heal by second intention. So this little mare injured herself in the trailer on the way here. But then today, she re-injured the same spot worse. So, sometime between the 4 days that it took them to drive here, we lost the ability to really close that original one. But these upper parts that looks like she just ripped, I might be able to close part of to try to save more of the skin flap. So, that's what the plan is. Yikes! That's big, man.
She also has a lot of like soft tissue changes in her joint capsules.
That's weird.
Yeah. And she's got joint collapse in her tarsi. And maybe an old OCT lesion. I have to go back and look at them again.
This is gonna be kind of beautiful.
She's got some dorsal spinous processes that are close to touching. Why aren't you going back anymore? So like all the other horses, she has the same wave going on. They're all related. And then this 109 and 209 are lucent. So they've got dental caries or they're starting to rot away. They're not as robust as the other teeth, but if you look, you can see lots of little spaces in between each tooth that are pretty defined, and they're not supposed to have that much space in between each tooth. Those are what we call as diastomata or diastema if there's one. And food can get packed in there and things like that and cause gum disease and bone disease, things like that. The rest of her teeth otherwise look pretty healthy. And these ones up at the front, that root is really blunted. And so that shows that there's compromise to the root, and this root isn't as robust as it should be, and then that root's almost completely gone on that tooth. So I'm a little worried about some of the roots of her teeth, but as far as the occlusal surfaces go, they look okay. There's just a minor wave. This one also has a lucency right there through the center, so she might have a partial fracture.
Okay.
So while Dr. Lydia was doing the suturing of Indy's forehead, Nicole and I did radiographs on the rest of her. Her withers in the most proximal part, so up here, she has one of her dorsal spinous processes that is creating new bone, and it's going towards the dorsal spinous process that's immediately in front of it. So if those start growing together and touching, that's going to cause some pain. She has some dorsal spinous processes in other places that are close, but they're not touching, like in the last horse that we looked at. Her right front carpus has some osteoarthritis in it and some soft tissue joint changes that you can see on radiographs, which we normally don't really see too well. And then both of her hocks have joint collapse with some joint changes in that area. And then her teeth, like all the other horses, and Dr. Lydia already mentioned, are pretty much the same wave mouth as the other horses. She has the 09s on the maxilla that both look very compromised, and another tooth, I think it's the 10, that looks like it might have a partial fracture around one of the pulp cavities. So that's not super great. The occlusal surface itself is just a small wave with some small points. Other than that, there's just some kind of roots that look blunted and shortened and kind of compromised. So she's probably another every 6 months kind of horse that needs to be seen by someone that's really interested in equine dentistry, maybe an equine dental specialist. I think those teeth will probably have to come out eventually. So the hand floats will not do it.
You don't like it and you're grumpy, and that's okay, but you gotta cooperate, okay? You got the grumpy face. Ooh, ouch. Yeah, she's got major kissing spine back here. 1, 2, 3, 4, 5, 6, 7 locations. So this looks great. And then we hit here and we are touching, touching, touching. Touching, touching, touching. So she's missing this tooth.
Yeah.
And somehow I cut it off both times. We've got a lot of spacing.
Oh yeah, those teeth are probably.
This one, this one.
Oh.
These three, this one, and this one.
That one might be fractured in some places.
We can see tooth root abnormalities. Oh, ouch, look at that fracture. Oh my goodness. Look at that fracture right there.
Oh yeah.
Ouch. Yeah, this mare's painful. So unlike the last mare, this, and then look at these. I think this mare needs to be a priority, like on pain meds. Yeah, okay. You're okay. You're a good girl.
The other two will be over here in this barn.
Okay, okay. There we go. She is the one mare from this group that had a career as a racehorse. And she's about 23 years old. She has been, I'll see if she demonstrates this. She's been really, ma'am, don't choke yourself. She's been really unhappy in her interactions with humans since she came. And sometimes that's just a bad experience, but sometimes it is pain related. So we came into this intake exam expecting to find something potentially painful. And unfortunately what we found with her, and she's kind of a good example of how anatomy affects problems sometimes in thoroughbreds are bred to have these really, really long backs because it makes their stride length longer when they're running. But in this mare, it's resulted in multiple vertebrae, between 6 and 8 vertebrae in this section of her spine and this section of her spine that are touching each other, and her back is quite painful. But unfortunately, we also found 2 very obviously fractured teeth, but another 1, 2, 3, 4, 5, 6, 7, another 7 teeth that appear to be compromised. So we didn't aggressively push to do an oral exam because one of those teeth is fractured straight in half. It's a slab fracture. And I think that likely is causing her a lot of pain. And if you go up to her face at all, now she's not doing it. She right away pins her ears pretty aggressively. That was pretty mild, and moves her head away. So you can see she's, even with 2 different kinds of pain medications and a sedative on board, she's very clearly communicating, please do not touch my face hurts. So she is one that our team hasn't discussed yet, but I feel pretty confident that I will make a recommendation for the last act of kindness. We have to consider quality of life. This mare has a lot of discomfort in her back and a lot of discomfort in her mouth. She also has really thin soles and is very footsore. So when you watch her walking, her feet are also hurting her. The foot soreness is something that we can definitely treat and improve with appropriate farrier care, but she has so much dental pathology that it would be a lot of surgery and likely extractions of most of her premolars and molars to try to get her comfortable. And as a 23-year-old horse who does not want anything to do with humans, I think the kindest thing for this lady is to make a last act of kindness recommendation. She supposedly is trained to ride, and so that may also be contributing to why she doesn't want a lot to do with people. If she had a bad experience, I don't know. She is a red mare, they're a bit spicy, but she's had some really good pain meds. One of the other things, and I don't know if she'll do this because she's sedated now, but bruxism is grinding of teeth. And horses that chronically clamp and grind their teeth, that's another one of those indicators of long-term pain. And so this mare's been doing that since she got here as well. So that was another clue that she had some chronic pain going on. So see, she really, even just initiating a little bit of contact, she communicates pretty clearly that she would rather just be left alone. And it's important for us as animal people to recognize that some of these horses really desperately want love and affection and interaction, and others of them very clearly do not want that. And we try really hard to read their body language and to be respectful of what they want. So that doesn't mean we don't provide them with appropriate care, right? Like we had to do a full, thorough hands-on exam today, but it does mean I'm not gonna force her to snuggle with me like we might some of the others. So of the 8 that we looked at today, 5 appear to be in pretty great health, other than really horrific feet. So I will say that with a caveat, they need farrier care before we can take really good foot radiographs and do lameness exams on them, because they're all lame, because their feet all look terrible. So our wonderful farrier is gonna get out here as soon as he can to provide farrier care. So 5 of them appear to be in good systemic health. 3 of them had some really significant concerns. This mare had the most significant concerns. All 3 of the ones that we've looked at have kissing spine. It's really important to pair the radiographic finding of those bones touching each other with palpation of the spine and watching the animal move, because sometimes they have a great quality of life with this condition. It does have a tendency to worsen over time. So we don't ever want to just look at an x-ray unless it's like, this leg is broken in half, and just be like, we're going to make a decision based on this x-ray. And because all these animals were sedated today, they all have follow-up scheduled to make sure that we can be as thorough as possible. But yeah, overall, it was a great day, and doesn't feel like a lot of patients to see. We only looked at 8 horses today, but we try to be as thorough as possible to be as fair as possible to these horses.